stick with it. Research it. It's a challenge. If it challenges you and there's no answer, find the answer. I think there are definite improvements. Medicine marches on.
Hi, I'm LaShondra Robinson. I'm the pediatric manager in Hayward, the GSAA. I've been here 16 years. The patients drive far to get here. The patients that I encounter, I'm always in the waiting room, always walking around. I'm always trying to engage every single member. And so from the feedback that I receive, it appears that the patients are very satisfied with us. We definitely believe in quality and service. And so we try and achieve very high scores in quality as well.
Hi, my name is Lisa Hills. I am the manager of respiratory care services / pulmonary clinical services for both the Hayward and Fremont Medical Centers. I've been in the field of respiratory care for the last 23 years. One of the things that we're seeing more and more prevalent these days in the Black community is the rise of asthma. Asthma is becoming one of the leading killers among the young Black children today. However, asthma is a very treatable disease. It's a chronic disease that can be lived with. We have a tendency to live in those communities that foster those type of chronic diseases, and we just really need to create an awareness among our own people, because we have a higher risk, I believe, because of where we live, simply because of that.
My name is Stroy Moy. I'm a EVS supervisor here, located in Hayward, California.
And my name is James Bostic, the Environmental Services Manager for Kaiser, Hayward, and Union City.
My name is Wendell Young, and I am the Access Control at Kaiser, Hayward. This is a good place to work for. The people are easy to work with. I enjoy my surroundings. It's tough sometimes, but it makes you work hard. And if you spend your time doing the do's, you don't have no time to do the don'ts.
My name is Sherry Smith. I work in Hayward at the clinical laboratory. I am the senior receptionist here. One of the things I like to do for Black History is to find Black History facts that we don't hear every year and post them up on the desk so that people can read them as they come in to get their blood drawn. Me personally, I like working at Kaiser. I love the diversity. I love working with different kinds of people and catering to all different races.
Hello, my name is Kimberly Scott. I'm the Chronic Condition and Outpatient Nutritional Service Manager for the Greater Southern Alameda area for Kaiser Permanente. I'm also the President of the Bay Area Black Nurses Association, which is the local chapter of the National Black Nurses Association. It has been around for 40 years. The Bay Area Black Nurses Association helps to recruit African Americans into nursing and into leadership roles. This is my second term. In regards to the trust that the African American has in the healthcare field, has been skeptical at times. We look at the Tuskegee experiment, which validated some of that mistrust of the healthcare system. Even as simple as the flu shot, still the conspiracy or the thought that they're being injected with something is still there and very present and very real to them, which poses issues for us trying to improve our health status of the African American community as a whole. We speak to the disparities of African American professionals and leaders in the healthcare industry, and we're trying to work very hard at California Institute of Nursing and Healthcare, and the Bay Area Black Nurses is focusing on recruiting more African Americans in leadership in the healthcare setting.
And that's kind of the question too, is, you know, are African American physicians even applying? When I hire people, I don't even look at their race, right? I look at the quality of service and care that they can provide. And I'm very strict, and I ask tons of questions, and their race doesn't even come into play.
excellent. African Americans who came from the South to the West came with spirituality, which being the basis of their belief system, and believing that the higher power or God would heal them, and that they didn't necessarily need doctors and nurses to care for them. Yes, your faith is very important for your healing. You also need to use outside resources and people to help in that healing. Bay Area Black nurses, as well as Kaiser, have put on screenings in the community that are faith-based. So there is a strong connection between outreaching to the African American community and improving health. When I was in grad school, it was my first time learning about Margaret Grant C. Cole, who nursed alongside Florence Nightingale in the Crimean War. And so that made me feel very proud that even though we don't hear about it, there were African Americans in the late 1700s that were very, very influential and started in the healthcare setting. So I think when you know about your history, it is encouragement, it is inspirational. It's really important for us to be educated about the history of not only healthcare, but African Americans in healthcare, as well as encouraging people to go into nursing, into medicine, as well as administration in the healthcare field. There are disparities because there's a lot of people who cannot identify with what someone's going through if you can't identify with them. I've found when I used to work as an emergency nurse at Kaiser, Oakland, I was very beneficial in helping an African American male who was having a heart attack to even just get an IV. The power of being able to identify with someone and to move toward healing or move toward just kind of receiving care is very important.
I don't receive any patient concerns from the African American population. They definitely appear to be very satisfied. We're meeting our HEDIS goals.
There are a lot of African Americans who are disproportionately affected by diabetes and hypertension and heart disease.
What we need to do is raise the awareness of asthma, what causes asthma, what triggers asthma, how to treat asthma, and really truly we can prevent asthma too if we look at things of our environment, triggers of asthma, dust mites, all the environmental triggers, what triggers allergies. Asthma is an allergic reaction. How can you control your allergies? What contributes to your allergies?
And just understanding how Kaiser as a model of care is really approaching taking care of chronic conditions, and just seeing the information that is out and understanding that, you know, going to churches, going to community screenings, looking at the diet, the African American diet, not losing sight of their cultural and historical foundation, community that is affected more so than their counterparts, 3 and 4 times disproportionately affected by these chronic conditions.
Like a lot of our communities are located near industrial areas and things like that. We're more at risk for contracting a lot of these chronic diseases, and so we really need to educate ourselves that so we're not as vulnerable as the rest of the different communities.
How can we use that as information for us to be more effective in outreaching to the African American community? I would like to first say that I am extremely proud to work for Kaiser Permanente. This organization focuses on diversity. I feel very comfortable specifically in the GSAA, where I can see leaders and peers that look like me. I want to be an encouragement to little girls and little boys that you can be a nurse, you can be a doctor, that the color of your skin does not determine your destiny, that actually look at it as an asset for you to becoming a leader in whatever you believe that you can be. I am the first college graduate in my family, and so I'm extremely proud of that, and I believe in mentoring. It's so important for us to lead by example and to bring those that are coming behind us up, because if there was not a Margaret Grant C. Cole, if there was not a Harriet Tubman, if there was not a Martin Luther King, then maybe I could not even see myself where I am today. So I'm very appreciative of my heritage and who I am and those who have led before me.
Thanks for joining in as we celebrate our rich heritage and accomplishments as physicians, employees, and leaders of Kaiser Permanente.
And happy Black History Month to you all.
Happy Black History Month.
Everyone enjoy Black History Month.